Hello, everyone, and welcome to an HR for Health webinar. It's our first one of the year, and we're really excited to be sharing some of our updates to our software and some upcoming releases that we have in store for 2024. But first, I want to give you a quick introduction to our host for today. Her name is Ryan. Well, I guess the speaker for today. I'm hosting this, which doesn't matter. Ryan is our product specialist, and she's been with HR for Health for over 4 years, and she's seen the evolution of our software, and it looked very different just a few years ago to what it does now, and that's because of the work that she and her product team put into this. And the reason why she puts all this time and effort into our product is because compliance doesn't have to be boring and it doesn't have to be difficult or complicated. We make it a lot easier for those that use our software, and we're constantly evolving and changing to meet the needs of our clients. And having these webinars is another way that we gather feedback and listen to what your comments, questions, or concerns are in regards to our features. So for today, we're going to go through these different topics. I know it looks super long. I swear there's not 50 slides after each number, but it's just broken down to, so that way when you download this presentation, you'll know which number and just how many features and updates that we're coming out with. So we're going to do a brief introduction. We're going to go through some new time off features within our software. We're going to show you our new automatic logout, how long it takes and how to use it, and what does it look like for when you are implementing this. The mobile clock-in features, payroll, some notifications, and some updates to even, yes, we do update the employee handbook. It's always perfect, but we still leave room for improvements. And at the end, we're going to talk to you about our brand new product that is launching later this month. So with that, why are you all on this webinar today? Why do we bombard you with emails to register for this webinar? And why do we think it's so important that you sign up and attend these? And the reason is because HR for Health is the only HR software that's built for healthcare practices. I'm not just saying that because I'm in marketing. It's actually true. We are the only healthcare HR software. A lot of other companies cater to any type of business, small business, big business, whatever it is, but none of them truly cater and build their software to be for healthcare and dental practice owners. So we make this easier and more efficient and effective for you based off of the feedback that we hear from our clients. So we have a team of legal experts, HR experts, and we want you to care about these things because your input is used for the software. And Ryan's going to tell you exactly what that process looks like on how we gather that feedback. But we really want you to care about these things because the software is designed with you in mind, and it's designed for healthcare practices. So I don't want you to feel like we aren't listening and we don't hear you. That's what makes HR for Health really special. And we do gather all of that data and insight and the comments and questions that you have to build this and make it make sense for your healthcare practice. So I want to hand it over to Ryan, who's going to tell you exactly how we take that feedback and how we've used it for all of these features and updates that we have for today. So here you go, Ryan.
Thank you. Thank you, Taylor. Hi, everyone. Thank you for joining today. As Taylor mentioned, we're going to be getting you up to speed on what our product and engineering team has been working on over the last several months. We are constantly striving to ensure our software is not just meeting the needs of our clients, but exceeding those needs. Let's face it, HR is not the most exciting subject, but when you have a software that was built to keep you compliant and provides the tools that you need, as well as making HR super simple, you can't help but get a little bit excited, maybe. So how do we as a company choose what features to build or what features need to be improved? The answer to that is a little complex, but in summary, we do take a look at the product usage and the data, we research the market, and most importantly, we listen to you, our clients. Some companies may not be open to the suggestions, but that's not us. Today, we will be highlighting some of the recent improvements and a big feature we have been working on. So let's jump in. The first thing we have here is an improvement to our time off feature. So knowing when an employee is taking time off is not only important to document, but also very important to gauge availability. And when you need to find coverage, is that coverage needed for the whole day or is it just a partial portion of the day? And having that extra visibility is essential. HR for Health time off tracking allows you to easily track time off in one place and allows for transparency. You and your employee will be able to see the PTO, sick leave, vacation, time used, how many hours are remaining, and employees are able to request time off within HR for Health, and you are actually alerted to it in real time. So you can approve it as you go and easily apply that time off to a time off bank that will be in their account. And so that those hours always get deducted accordingly. To ensure you can easily see the times that you may need to find coverage, we implemented an improvement for employees to request partial time off. With partial time off, employees can specify the request for the partial day and can add in time, start time and end times. So for example, maybe they have to leave for a doctor's appointment at 10 a.m. and it will only be 2 hours long. So the employee can technically work the rest of the day. So in that case, they would just put in a request from 10 to 12 and they'd be able to work after. So why is that important? For compliance, obviously, it's always important to document when they're taking time off. And of course, it's always good for transparency purposes for you to know when they are available. The next improvement we had is to our automatic, technically it's our timekeeping, so automatic logouts. But before we get into that next improvement, let's talk about HR for Health's time clock and why is it important to have a time clock like HR for Health. HR for Health's time clock was built for your industry and with compliance in mind. It will base its time tracking on your state-specific laws for overtime, so nothing manual is needed on your end. And if you live in a state with mandatory rest breaks, it provides a reminder to your employees when they clock in to take their breaks. So just an added compliance there. It is also IP specific, so employees can only clock in from an authorized location and while on your office's Wi-Fi. And it's also tied to our tardiness feature, so you can track if an employee is showing up late. Although it is almost perfect, we know that there's always room for improvement. So the next improvements have come about after listening to pain points our users were facing, and these are actual things that we've heard. So things like my employees forget to log out of their HR for Health account, and I'm worried another employee may try to access their information. Is there a way to log my employees out automatically after clocking in? Or we only have 2 computers for employees to clock in and out, and our office is large. Is there a mobile app? So we are going to jump into what those improvements were. So that first one is the auto logout. We updated our system to have an auto logout time from 1 hour to 15 minutes. So there's no longer that 1 hour time frame. So if an employee forgets to log out of their HR for Health account, they will automatically be logged out after 15 minutes of no usage. This is just an added measure to keep their information safe when they walk away. We have also, if 15 minutes is too long, which sometimes it is, especially with a big practice, we have also added a preference for auto logging out your employee after they clock in and out. So once they clock in, they will get a warning that they will be logged out in 10 seconds unless they click a button to remain logged in. This is in case they need to complete something within HR for Health. They can choose to stay logged in. This may be ideal for any users who have employees using the same computer when clocking in and out and ensures their information will not be seen by other employees. Let's see. Next, we have that mobile clock in. So we do get that request again for, hey, do you have a mobile app? And if your office is one of those, or you're an office with few computers, we do have a preference where you can allow for your employees to use mobile clocking in. What this means is that the employee can use their cell phone to clock in, but only when they are at your office and connected to the IP address or the Wi-Fi. And we have improved that mobile functionality to ensure that it's easier for our users to locate the time clock when they're on a mobile phone. So keep in mind, this is not actually an app. Employees can access HR for Health by pulling up an internet browser on their phone and going to the HR for Health website. All right, The next improvement we had was to our payroll feature. So a little bit of background about this. With HR for Health, you can run a payroll report in our system and gather all hours worked, overtime, double overtime, any paid leaves, payouts, so like bonuses, reimbursements, and any paid holidays. That can all be tracked within HR for Health. Of course, all overtime is based on your state's regulations, and you are able to run a report regardless of the package that you have with HR for Health. So even if you don't have our payroll processor, you are able to still run a report that you can provide to your payroll. Our users who just had exempt salaried employees wanted the ability to process a payroll report for just their salaried employees who had no hours in our system since they were not actually using our time clock to track that time. And this is usually where their office is set up with, where they just have like all of their administrators or like office managers in one office. It's usually bigger practices. Previously, our payroll provider would set all of that information up on the back end, and any changes that would need to happen would have to be communicated to the provider either over by phone or by email. So definitely some manual process there. But now, if you do have our payroll package, you have the option to close and run a payroll report for just salaried employees. And in that report, we do have a note section where you can add any important information or changes that can be sent over to the payroll provider through the software. So again, helping automate that process and take out any of those manual extra steps. All right, next, let's talk about HR for Health's alert notifications that have been updated. But before we get into that, let's kind of go over the new hire checklist. So staying up to date with new hire documentation can be really time consuming and can leave you or your manager researching for hours on what's needed. Documents are updating all of the time. So this year alone, there is a new I-9 form that was updated mid-year and a document for the Pregnant Workers Fairness Act, and making sure you have all the mandatory documents for your state and federally is so important. But not just that, there are also other documents that you should have your new hire sign to ensure that you are as compliant and safe as possible. HR for Health provides all mandatory documents for your state, but we also provide you with all of your recommended documents that are recommended by our legal team, and even some optional ones based on your state, all in the name of compliance. And what's even better is there is a new document for the new hire checklist. When there is a new document for the new hire checklist, we do add it into the new hire checklist for you, and you have the ability to accept that new form. So it's super simple, and you don't have to go researching or looking for that specific document. Employees who are hired on by you and added into HR for Health are automatically sent those documents to electronically sign when they register. And those documents are going to pre-fill with your office information and the employee's information. So it only takes about 30 to 45 minutes for them to sign, opposed to you needing to print the documents, fill them in by hand, and then of course have your employees fill them out. And to ensure you stay up to date on the latest, we have made an improvement to our alerts for that new hire checklist, and you will now be alerted to any new document or updated document in the new hire checklist. So you can ensure that you accept it before that next new hire comes on board. All right, next we have our employee handbook software. So we have made some improvements. Even though it's amazing software, there's always room to make it a little bit more streamlined, a little bit more easy for our users to get through. So with that being said, if you're not familiar with it, our employee handbook generator allows you to answer a questionnaire within our software about your current policies, and it generates a compliant and custom handbook for your state based on your answers. With our handbook software, you have the ability to receive automatic law updates when your handbook laws change, which ensures that your handbook is up to date at all times. And there's no manual work or oversight needed on your end. It also will automatically send out the new handbook to you, your team, and you, so that you can sign it electronically. And to ensure the process is as painless and trouble-free as possible, we have made things a little clearer. We have added additional confirmations when you make edits to your handbook policies to ensure you know what should happen next. We have added more guidance when adding custom policies to ensure the changes that you are making are getting sent to your employees. And we have made it clear when you are saving your handbook as a draft versus when you are actually sending it to your employees. So you have more understanding about the whole process. All right, and before we get into our next slide here, there is one other change that we made, and this is just kind of like a broad thing, but we have made some changes to verbiage. So we used to refer to our time off policies as benefits. So if you're a current user of HR for Health and you may have saw those changes, anywhere where it used to say benefits is now referred to as time off policies, just because usually benefits are referred to as medical, dental, vision, and our benefits that we were referring to were PTO, vacation, and sick leave. So if you ever have any confusion there, you can now refer to those as time off policies, and you can find them underneath time off policies. All right, before we jump into this next slide, I do want to show you guys a quick glimpse into how to set up that preference for auto logout. So I'm going to go ahead and sign in here and show you the steps. So if you do want to take advantage of that auto logout, you can go to your management section on your account. Go ahead and select setup. You can go to preferences and you'll see this little new banner. We're adding those throughout the website as new changes come, or like new things to certain places. So for example, this one's for preferences. You can go into the preference and you'll see here that we have this option to automatically log out employees after 10 seconds. So we're gonna go ahead and edit. We're gonna change this to yes. And if you're ever unsure of what something means, we have these little tooltips throughout the website. I highly recommend taking a look at them. Usually it will provide you with some much needed information. We'll click submit, and now that I have turned on that preference, when I clock in, I will be alerted to either, it's gonna, well, you'll see. So here you can see that it's gonna automatically log me out. It gives you 10 seconds. It does have a countdown here. So I can either opt to stay logged in, which I'm gonna do, or it will automatically log me out. It also does this when clocking out. So if I click clock out, it's gonna give me that countdown again. And if I don't do anything, it's gonna just log me out after that 10 seconds, or I can say, no, go ahead and sign me out now. All right, let's get back into that webinar. All right, so the next thing we have, and the new thing that we're gonna be talking about, is a whole new feature. You may have heard about the rumblings if you are a current HR for Health user, but if you are not, coming later this month, we will be launching our employee scheduler. So very exciting. This came after many requests from our clients over phone calls, cases, our feedback button in the software, and of course, a need within the industry. And so many practices are using Excel spreadsheets, paper schedules, group chats, and other outdated and tedious methods to track, the schedules. There's lack of visibility, and managing is just a headache. So with HR for Health, you will have an all-in-one HR and scheduling tool to bring efficiency and visibility to your office. Not only will your teams use the same scheduling tool, but they will also have all of our other features. So our integrated timekeeping, time off tracking, holiday tracking, and attendance tracking, which are all super important when using the scheduling tool and making sure that you get the most out of it. With our schedule, you can add your employee shifts. You can copy those shifts to future weeks. You can see and manage time off requests within the schedule, giving perfect visibility to who is taking time off, when they're taking time off, and of course, what times. You can see any upcoming holidays and assign employees to those holidays from the schedule feature, and you will be alerted to any shift conflicts. So if an employee is ever scheduled on a day that you have time off, or they have time off, a day that there's a holiday or another shift at a different location, you will have visibility to that. You will also now have the opportunity to base your attendance tracking on employees' scheduled shifts, so you can easily see if and have automatically documented when an employee is not showing up on time or at all. So right now we do have that tardiness tracking, but it's not based on scheduled shifts. So if a shift changes, if they pick up a shift on a certain day, you wouldn't necessarily have that documentation if they weren't clocking in based on that scheduled shift. And employees will now have the visibility to see their schedule after it's published. So they know when they work, when their peers work, who is taking time off and when, which is super helpful if your office has a first come, first serve policy for taking time off. And employees are also sent a weekly email of their upcoming schedule to ensure they're always in the know. And with that, let me show you this. We're excited, get excited. You're gonna be hearing a lot more about it as the days come. But I will go ahead and kick it back to Taylor.
Thank you, Ryan. And I'll assume that all of you are screaming behind your computers or phones right now, even though we can't hear you, but we're really excited about this and hope that you are too. And you can scan this QR code to go to our website and review all of the functions that are coming with this employee scheduler and keep updated with it. And we will make sure to keep up with emails for you so you can see what's happening and when the official launch date is. But for now, I see that there is some questions in the chat, so I'm going to ask, let's see, can the staff see the scheduler? I think.
Yep.
Yes.
Yes, so they can see the schedule. They will have a little bit more limited. They'll have everybody's schedule. They just won't be able to see certain shift notes that you put into other people's shifts. They will be able to see their shifts though, that time frame. They will be able to see the time off of the other employees as well, just in case you do have one of those first come, first serve policies.
Sweet.
And then
this one says, when they work partial time off and come in later than the start time, it shows up as a tardy. Are you working on changing this?
Yeah, so when you base it on the scheduled shifts, what will happen is even if there's, so one, their shift would be slightly different and they would have a time off request or should have a time off request for that time. So what would happen in this case is it wouldn't show up as tardy because they have that time off request. So essentially they would have, let's just say, the time off from 10 to 12, and then the rest of the day would be that shift from 12 to end of day. And of course, you could have a shift before that. If not, it would show as a conflict if you have the shift from 8 to 5 and then the time off from 10 to 12. But it should not show up as tardy.
And then the next one, will it show which location they're working at?
Great question. Yeah, so if you have location tracking right now set up in your account, you will have a drop down of the locations that you can filter by. Also, when creating that shift, you will be able to assign them to a specific location. So let's just say you have employee A needs to work at your San Francisco office. You can actually put that in their shift so they know exactly where to go. Great questions.
Right now, that's all I'm seeing in the chat. I'll give you a few seconds if you're typing right now. Oh, wait, I see. How much is the software? So that depends on which package you're looking at. I would recommend that you go to hrforhealth.com/pricing. I will type it right now in response, hrforhealth/pricing. And you can see which options we have based on the size of your practice, how many locations you have, and how many employees are at your practice.
All right, if we already have the software, is the employee scheduler included? Great question. So when we launch, there will be a trial period. So you will have it for a portion of time to try out to see if you like, and then hopefully you do, and hopefully it makes your life easier and we keep you on board. But I think it will. Going through all of our testing, we had beta clients and they really enjoyed it and made their life a lot easier. A lot of the feedback that we received was how seamless and effortless it was and how intuitive. So hopefully it would make the same for you.
Let's see. Okay, so to answer part of the software and with the payroll company, I am saddened to hear that you like your payroll company, but that is totally fine. We do have different packages where payroll isn't included on them, so that might be a better option for you. You'll look at the first option that we have, and I think it's the basic package, and you can see if that makes the most sense, given that you already have a payroll company. But maybe you'll end up loving us so much that you'll change your mind. But until then, we won't bribe you for it. Is there an additional cost to the scheduler if we are an existing company? If we are. Oh, so if you're already using HR for Health software, I think is what that means.
Yeah, eventually it will be an add-on, so more information to come on that later on. Great question.
This is so fun. Does anyone else have questions? There's 12 of you in here. We have plenty of time. Thank you, Gina, for being here and asking all of
Yes,
these.
thank you. Love it. All right.
Okay, I think that is it. Go to the next slide, Ryan. I think that should have our, okay, so here is our URL, our website link to visit us, and you can check out all of our services. Not to brag or anything, but we did just update our whole website and it's beautiful. So if you have just some extra time on your hands and you want to look, please feel free to. And if you also have extra time and you still have more questions, but you were too nervous to ask us on a webinar, please email us at hrforhealth.com. Hello, yeah, at hrforhealth.com. We do answer these, I promise. We don't just stick it up there and forget that the mailbox exists. Our whole team gets access to it, and so we will make sure to respond to you and answer any questions that you have. Oh wait, Brian's coming in at the last second. Let's see.
Yeah, no worries, I got it. Will only management have access to edit the scheduler, or can we assign to team leads to make the schedule? Great question. So our permissions are super flexible. So you can provide access to your team leads or your managers to be able to create shifts for the scheduler, to edit the shifts. We even have self-approved. So if you have a manager who needs to create it for other people and herself, you could do that as well. But yes, very flexible, and it will be available to whoever you want to provide permission to.
This is your live action view of how we took real feedback and we put it into the building of the software. This is awesome.
Yeah, and if you ever have feedback, please feel free to submit it. We do have a feedback option in our resource center when you're in the actual software.
Awesome. Okay. All right, I think that is it. Go ahead and write down our email. Thank you all for us. Yes, this webinar, thank you. I should have said that before we wrap up for today. This webinar is being recorded right now. The second that we're done, I'm going to upload this and follow up with all of you via email. Make sure that you have a copy of not only this webinar, but you will also get a copy of our slide deck. So you can have it on hand, review it. I know that some of this lingo is not something that you have to memorize. You already have to memorize enough things. So we will make sure that this gets into your hands and you can take notes and follow up with us. And I think that is pretty much it for today. So thank you all for being here. We really appreciate you, and we couldn't do this without you. Have a great rest of your day.
Thank you. Bye, guys.
Bye.